than great tits and a pretty face. Welcome back to the series where I talk about what plastic surgeons do besides just boob jobs and facelifts. And I want to thank Fabletics for this month's scrubs because it fits perfectly with our theme. We all know pink for breast cancer awareness. Well, part of breast cancer care is breast reconstruction. And I've gotten a couple questions on a particular type of reconstruction I'm going to talk about more. First, I'll share what set this is. This is the One Pocket Vitality Scrub Top. I prefer these because I think they're really cute, tucked into the high-waisted pants, whether those are joggers or these, which are the high-rise, wide-leg scrub bottoms. But getting a little bit more into this option for breast reconstruction, whether that was a mastectomy for cancer or prophylactically, the DIEP flap is an option to use your own tissue to reconstruct a breast mound. It stands for a deep inferior epigastric perforator artery, and that means it's a flap of your own tissue that we're going to disconnect from one area and plug in to reconstruct the tissue somewhere else. Since the DIEP is the blood vessel that supplies the skin of your lower abdomen, that's where we're going to collect the tissue. It's going to be a cut that goes pretty much from hip bone to hip bone, and when we first make the incision, it makes a big elliptical shape because we're going to take out this whole section of tissue, and the tissue that's left behind in the upper part of your abdomen is going to get pulled down and sewn so that in the end the scar is a straight line across the bottom of your belly. The layers that we're going to take out with us as part of the flap is the skin and the subcutaneous fat. We're going to leave behind the muscle. However, we do have to dissect into the six-pack muscle to divide out enough length of that blood vessel to take with us to plug in to create the flap. Unlike other flap options where we actually take those six-pack muscles, which we can talk about in another video, the DIEP flap does have a lower but not zero risk of hernia or other abdominal wall complications. Then plugging it in to create the new breast mound. We can do it completely buried if you're having a type of mastectomy where you get to keep all of your skin and nipple, or if it is a type of mastectomy where part of the skin is going to have to be taken out, we can also use the skin from the belly to help fill in that defect. So the DIEP flap can be a really good option for patients that have enough tissue to spare on their belly to create a breast mound. A lot of people don't like the idea of having an implant. They don't want to have to continue to do the surveillance to make sure that there's no implant rupture in the future. Or they like the idea of having a breast reconstruction option that is able to gain and lose weight with them as they move on through their life. On the flip side, it is a complex surgery and a very long surgery for your body to undergo initially. You may end up with less surgeries than doing an implant, but that does not guarantee that it will be a one and done surgery. A lot of people, even with autologous breast reconstruction, end up having to have another surgery for revisions in the future. But kind of the two major risks of having this surgery is that the flap can fail, and then you're also going to have to heal two major surgical sites at the same time. So picking out which breast reconstruction is best for you is a discussion between you and your plastic surgeon during your cancer care. And as always, if you have other questions about plastic surgery topics you'd like me to cover, drop them in the comments.